175 people have died. These are very big numbers to show how relentless the virus is. The Trinidad and Tobago position is as follows. Samples tested to date, 1,045. Positive cases, 109. And when we take off the group from the cruise ship, which is 49, we are left with 60. Of that, 4 are from Tobago. Deaths today, unfortunately, are 8, 7 in Trinidad and 1 in Tobago. And discharges to date are 1. What is the update at the hospitals? At Couva, we have 74 patients. 1 is in ICU. That person is stable and not ventilated. In the high dependency unit, which is a step down from an ICU, we have 3 people and all are stable. We have 70 other people who are able to walk around. They are hopefully on their way to recovery. Today we may have 2 possible discharges. We are just waiting for their second negative test to come in. And between today and tomorrow, we have the potential transfer out of Couva of 32 people to go to a step-down facility. In Cora, there are 26 patients who are able to walk around. They are what we call ambulatory. They can walk around. In Balandra, there are 22 persons. This is the remainder from the cruise ship group. They were all swabbed yesterday. Once their tests come back negative, and let's hope and pray that they do, they will be able to go home once their tests are negative. So that is some good news coming out of Balandra. At the Ministry of Health, we have taken a decision to ramp up our testing across the country to do what is called surveillance testing. From Tuesday, we'll be selecting 1 health center in every county where we'll be randomly sampling people who have viral illness symptoms, not necessarily COVID, but once you have a viral illness symptoms like a stuffy nose, a cough, a fever, we will start that enhanced protocol of sampling. The Chief Medical Officer is driving this initiative, and what that will do, as he has told me, will be to give us some idea of what is circulating in the country beside COVID, and if COVID is there in these communities that we don't know about. So we are expanding our testing from Tuesday. I want to address the issue of miking. We continue our miking efforts in Victoria East, Victoria West, St. Patrick, St. Andrew, St. David, and County Caroni. In Tobago, we have mic'd from Crown Point to Palatuvier to Charlottesville to Buku to Plymouth to Castara to Speyside. So we are micing all of Tobago, from Tobago East, Tobago West, and in Trinidad we are micing according to the counties. I want to address one last issue that the Chief Medical Officer was quite surprised about when he read the newspapers this morning about a possible lawsuit naming the Chief Medical Officer. I would just like to put the following facts on the table. The Chief Medical Officer was out on the field yesterday when his secretary called him and told him there was a letter for him from Attorney Omlala representing one person who was in Cora in what we call the suspect ward. These are people who are suspected of having COVID. This person, together with 6 other people who were tested negative, were in fact allowed to go home based on protocols established by Dr. Michelle Trotman and the CMO. This person was not released because of a threat of a lawsuit. The Chief Medical Officer issued no instruction to release anyone based on the threat of a lawsuit. That person, together with 5 others, were released via protocols, and we must bear in mind that we will overcome this if we stick to protocols. We will not be making decisions at the ministry based on the threat of legal action. So I just want to clarify for the country that the chief medical officer did not intervene in any way whatsoever to release anybody from Cuba based on the threat of a lawsuit. The person and 5 others were released because their tests came back negative, and the protocols were that if somebody is in the suspect holding area, for want of a better term, and their tests come back negative, they are allowed to leave the ward. So ladies and gentlemen, that is the update on where we are today. And when we close off, I'll be able to answer any questions. Thank you very much.
Thank you very much, Minister of Health. Let's hear from the Minister of National Security, the Honorable Stuart, who will speak on measures that have been taken to protect the population of Trinidad and Tobago during COVID-19. Minister Young.
Thank you very much, Minister Cox. Good afternoon to my cabinet colleagues, Minister Cox, Minister Dial Singh, and to the media and the wider viewing and listening public of Trinidad and Tobago. I'd like to start this afternoon's conversation with you just reminding and reassuring the population of Trinidad and Tobago that from the word go, all of government's plans and responses with respect to COVID-19 and how we deal with this global pandemic, this virus that can be deadly, have been guided by our Minister of Health and his experts, the Chief Medical Officer and the medical experts, those well-trained experts at the Ministry of Health. As well, from time to time, there has been intervention as we reach out to other medical experts in other jurisdictions around the world who are facing the same COVID-19 pandemic. So all of the government's plans, responses, and how we've been approaching the efforts with respect to COVID-19, the measures we've been implementing, have all been guided by medical expert advice. One of the ways to combat the spread of this virus is by restricting movement. You all would recall that one of the first things we did was begin the restriction of movement from the 30th of January of this year. The restriction of movement, and in particular with respect to our borders, is a step that is specifically designed to protect those who are within your border and to prevent a general movement around the globe which leads to a spread of the global pandemic, COVID-19. In fact, what you're seeing currently, and one of the raging topics in the last 24 hours, is countries who closed their borders and who had restricted movements opened them back or allowed movements to be unrestricted too soon. And what you then had is a surge of imported cases of COVID-19, as is currently happening, unfortunately, in Singapore as well as in Japan. Two countries that initially seemed to have control on their restrictions, and as soon as they reopen their borders, they're now dealing with that second surge, that wave, as more imported cases have come into Singapore and Japan. So the context of protecting our population with respect to our borders must be with that borne in mind. As at today, we have 109 cases, as Minister Dial Singh reminded us. Out of those 109, there are only a few, I think about 3, that are not imported cases or as a direct result of contact or primary or secondary tracing to imported cases. So far, the vast majority of our cases, almost 98%, are as a result of importation and persons bringing them to Trinidad and Tobago. Trinidad and Tobago first began restricting movements with respect to COVID-19 on the 30th of January of this year, when the Minister of Health asked Cabinet, and Cabinet agreed to restrict persons from China who had been in China for the last 14 days from entering Trinidad and Tobago. At the time, we were one of the first in the world to take such measures, and definitely the first in the whole Western Hemisphere. That was our first step and measure in restricting movement into Trinidad and Tobago. We then, shortly thereafter, based on the advice of the Minister of Health and his experts, accepted that we should add Iran, Italy, Singapore, South Korea, and Japan, and restrict the movements of persons who had been in those jurisdictions, in addition to China, from entering Trinidad and Tobago within a 14-day window. Shortly thereafter, the first person to announce it, soon followed by the regulation from the Minister of Health. The Prime Minister was the first to announce it on his return from CARICOM meetings, from Ghana. He added France, Germany, and Spain. So we as a government decided to add France, Germany, and Spain as our third measure. On the 18th of March, we closed our borders to non-nationals. So you all would recall that these are the 4 measures that we took, culminating on the 18th of March with a closure of our borders to all non-nationals, again done to protect those here in Trinidad and Tobago. On the 23rd of March, again based on the medical expert advice, we closed our borders to nationals of Trinidad and Tobago as well as non-nationals. This is not a step that was taken lightly. This is not a step that we took because we wanted to prevent our nationals from returning to Trinidad and Tobago. It was taken based on the medical advice that we were given by our chief medical officer and others that we needed to restrict the movement of persons into Trinidad and Tobago, and that was the appropriate time for us to do it. So on the 23rd of March, we closed our borders to nationals. The closure of the borders was to stop movement, to stop the spread of the virus, and to protect the population of Trinidad and Tobago in Trinidad and Tobago. You would recall the Honourable Prime Minister telling the population there are approximately 330,000 nationals of Trinidad and Tobago who are outside of Trinidad and Tobago. So there is no distinction in that category of 330,000 persons. There may be persons who've gone for vacation, persons who live abroad, but they are all nationals of Trinidad and Tobago. We had to take the difficult decision of closing our borders for the sole purpose of protecting the existing population here in Trinidad and Tobago of approximately 1.4 million people. To turn now specifically to our 33 nationals in Barbados. The 33 nationals in Barbados, the facts are as follows. When we announced the closure of our borders to our nationals and that the borders would be shut from the 23rd of March, they had not yet begun their movement back to Trinidad. They left Oman, they flew to London, and from London they got a flight to arrive in Barbados after our border was closed. So prior to boarding the flight from London to Barbados, they already knew of this decision that had been taken by the government of Trinidad and Tobago to close our borders. And they knew our border was closed. On the 23rd of March, this government spoke to the government of Barbados about those nationals. The government of Barbados was aware that our border was closed to international travel. They, as at that time, did not yet close their border to international travel, but the government of Barbados informed us that they had in place a mandatory quarantine period of 14 days for anyone coming in from the United Kingdom. Immediately on the 23rd of March, even before Trinidadian nationals arrived in Barbados, the government of Trinidad and Tobago provided COVID-19 testing kits from our quota to Barbados. I personally arranged that as the Minister of National Security on the RSS flight that was heading back to Barbados, and we put the 33 to 35 kits on that plane and sent them to Barbados for the government of Barbados to test our nationals, Trinidad and Tobago, who were going to be put into mandatory quarantine. We have kept in touch with the government of Barbados throughout the period. Barbados by that time had already imposed their mandatory quarantine period. So this mandatory quarantine period was going to end for those 33 nationals on or about the 8th of April of this year, 2020. But as I say, by the 23rd of March, the same day that we became aware, we provided Barbados with the COVID-19 testing kits for our nationals to be tested. All of these protocols and policies and procedures that I smiled as I heard the Minister of Health refer to a short while ago, everything being done with respect to our response to COVID-19 is being based on policy, protocols and procedures that have been developed in close collaboration with the medical experts, the Chief Medical Officer, the Minister of Health and others. On the 2nd of April, I received a letter from attorneys at law acting on behalf of these 33 nationals, informing us that there were 33 nationals in Barbados who were being quarantined, and this attorney at law was representing them and wanted to start discussing the arrangements for their possible return to Trinidad and Tobago. That was on the 2nd of April. On the 3rd of April, and I have refrained from doing this with respect to other matters and this matter, but I want the population to understand that the government of Trinidad and Tobago sought legal advice and medical expert advice, and that guided our response, our policies and procedures with respect to how to deal with this situation, bearing in mind we were protecting not only the 1.4 million here, but including our 33 nationals who were in Barbados at the time, because the advice from medical experts around the world, it is best to stay where you are than subject yourself to the risk of travel with a disease that spreads via contact. On the 3rd of April, this was the response of the government to the attorney at law for these 33 nationals. We acknowledge receipt of the letter dated the 2nd of April and said, with respect to your clients currently in Barbados, we are attempting to make arrangements with the government of Barbados to have them medically examined and tested for COVID-19. The medical advice that I have received is that they should be tested as soon as their quarantine period is completed, and they should also be medically examined. So we, the government of Trinidad and Tobago, are attempting to make these arrangements with the government of Barbados, provided that this will be accommodated. The testing and examination should take place on April 7th, after the 14 days quarantine period is over. Your client's application for exemption from the material regulations permitting them to enter Trinidad and Tobago are being guided by our medical advisors, as you would appreciate. I have also been engaging the Chief Medical Officer of Trinidad and Tobago about the quarantining of your clients on return to Trinidad and Tobago, and advise that his advice depends on the said COVID-19 tests and medical examinations taking place and their results. I will revert to you as soon as we've made the necessary arrangements for testing and examination with the government of Barbados. I am compelled to suggest that you inform your clients that one of the highest risk factors in contracting the COVID-19 virus is via air travel. Ladies and gentlemen, members of the media, population of Trinidad and Tobago, that is the policy and procedure adopted by the government of Trinidad and Tobago with respect to applications for exemption to return to Trinidad and Tobago. It is clear from the onset we did not say they would not be permitted to return, but we set out based on clear medical advice they should be medically examined. In this particular instance, we had provided COVID-19 tests as well, and that we would be in contact with the government of Barbados asking them to medically examine and to test our nationals, and thereafter the necessary arrangements can be made by them for their return to Trinidad and Tobago. So at the very outset, once contacted by attorneys, that was a clear indication and position of the government of Trinidad and Tobago. Let the quarantine period finish. We will arrange for medical examination, and in this instance COVID testing, because we provided the test kits. Thereafter your clients would be allowed to make their way back to Trinidad and Tobago. On their arrival, the chief medical officer along with his staff would make a determination after examining these nationals as to whether they should be quarantined by the state or whether they would be allowed to be quarantined at home in self-quarantine after having filled out quarantine forms, all of this being governed by the Quarantine Act of the laws of the Republic of Trinidad and Tobago. So at every step the law was in place, the medical examination, the medical experts were advising, and that was stated very clearly to the attorney at law. We, the government, have been dealing with the attorneys at law who held out that they're representing these people. We cannot deal with allegations, accusations being put forward via the media. Attorneys came forward, immediately they were responded to with our protocol and our procedure. I now want to just draw a distinction with respect to those persons who were in Guadeloupe on that cruise. The facts are as follows. The persons who were in Guadeloupe on the cruise were not returned to Trinidad and Tobago by the government of Trinidad and Tobago. The government of Trinidad and Tobago did not make any arrangements for the return of those persons who were on that cruise ship in Guadeloupe no arrangements were made by the government of Trinidad and Tobago. What we did is exactly as we would do in this instance. We facilitated the private arrangements that were made by those persons to get back with the guidance of the chief medical officer. We all know what happened. They also, it is factually important to recognize, they returned to Trinidad and Tobago before there was any ban or restriction on our borders. So they returned to Trinidad and Tobago before, way before the 23rd of March, making their own arrangements. Chief medical officer made arrangements for them to be quarantined by the state. We all know historically what has happened since then, and that was the right decision, provided with support by the Ministry of National Security to take them directly to a facility in Balandra, and we know what has happened there. So I want to put on record, the government of Trinidad and Tobago did not make the flight arrangements. We permitted them to make their own flight arrangements to return. Importantly as well, the persons in Suriname, the same type of correspondence is taking place between the government and lawyers on behalf of persons in Suriname. The government of Trinidad and Tobago is in contact with the government of Suriname. The lawyers on behalf of those persons have provided their details, their address, their contact information in Suriname. That has been passed to the government of Suriname, requesting that they assist us with the medical examination of these nationals of Trinidad and Tobago for their return to Trinidad and Tobago to be facilitated by them. On their arrival here, if we get past those protocols and procedures, again, the chief medical officer and his staff will examine them and make a determination as to what happens to them next. They will be quarantined. So the question that the chief medical officer and his expert staff will decide is whether via the state or whether to allow them to self-quarantine at home. At no point in time has any one of them, any of these persons, been told they cannot return. I must now, unfortunately, deal with an ugly matter that has reared its head this morning. The government of Trinidad and Tobago has been acting very responsibly and reasonably throughout in how we're dealing with the measures to combat the spread of COVID-19 in Trinidad and Tobago. Unfortunately, this morning, the Express newspaper saw it fit on their front page to start off a headline talking about race entering the conversation with respect to the 33 nationals in Barbados. I have just read to you in the clearest possible terms the government's position as put to the attorneys at law for the people in Barbados from the word go. The article went on, this Express article went on to then start to promote a conversation that I condemn. I condemn with every bone in my body. This government, and I can give the assurance to the people of Trinidad and Tobago, starting with our head, the Prime Minister, and I can speak for myself, this government does not operate on the basis of making any decisions, and in particular decisions related to a global crisis and a crisis, a medical crisis called COVID-19, a pandemic, on the basis of race at all. This is condemned in the strongest possible language and is completely repudiated. It is unfortunate that once again certain people are seeking to promote this race card in this time. I reject it completely out of hand, and I can say without any fear of contradiction that race has absolutely nothing to do with this. As the government considers every single case, not only of persons trying to return or asking to return, but also the cases that we are faced with on a daily basis, the race conversation does not enter our minds whatsoever. But there are those, it has become obvious, who are resolute to continue to try to push this race conversation and to push something in our psyche that has no place in dealing with the global pandemic and our country's response to the global pandemic of COVID-19. So I take this opportunity to completely reject it, to condemn it, and to put on record that race has absolutely no place to play in the conversation as how we deal with and the measures we implement with respect to COVID-19. And I will go further, that the population should look on very carefully at those who continue to push this card, blow that dog whistle, including the platforms that seem intent upon promoting it. I also would like to refute the editorial of today in the Express that suggested that I personally would tell a lie to the population of Trinidad and Tobago about whether we provided test kits, COVID-19 test kits. As I've stated here clearly on the record today, those COVID-19 test kits were sent for our nationals who were flying to Barbados from London on the 23rd of March after the borders had shut. And I can tell the population in a conversation I personally had with the Prime Minister of Barbados this morning, that was acknowledged. So there is no one, the Prime Minister of Barbados nor the Attorney General of Barbados, would deny that those kits were provided. She was very clear in her conversation this morning that she recalled and she knew that they were provided. So any suggestion otherwise is nothing more than a promulgation of a whole dishonesty and a downright lie. So people of Trinidad and Tobago, I continue to give you the assurance that with respect to all of our nationals out there, once they apply for the exemptions, they will be treated in an equal manner, every step of the way being guided by the advice from our medical experts, the Chief Medical Officer and the other experts, as well as consultation with the Minister of Health. And I give that assurance without fear of any contradiction. So we continue to deal with our nationals in Barbados, and I hope that they'll be given the clearance, and when they make their way home, they will be dealt with by the Chief Medical Officer and his staff for a decision to be made as to how they should be quarantined. It is absolutely no intention of this government to prevent any national from so doing. We are resolute that we must continue to protect you, the population present in Trinidad and Tobago. Thank you very much, Minister Cox.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. I recognize CNC3, Chester.
Hi, good morning to all the ministers and all my colleagues who are participating.
Good
morning. Good afternoon.
Or afternoon, actually.
Good afternoon, sorry. Wow. Some questions for the Health Minister.
Yes.
Out of the 1,045 samples that were submitted to CARFA, how many are actually people? How many people were tested or have been tested so far?
Right.
Another question is, why did it take so long to do the type of testing that you're now going to engage in with the health facilities? And the suspected unit you're talking about in Cora with the suspected cases, you said 6 people have been discharged. How many more people are in such units at Cora or any other facility? And one quick question to the Minister of National Security. In terms of the agreements that we entered to with the private security firms, were contracts signed, and given its cancellation, are we going to be held liable for anything?
Okay, so let me take the first 3. The Chief Medical Officer, together with the Public Health Lab, are currently working out the number of people. So as soon as we have that, we'll get that to you. While we are testing in communities now, this is all part of the global protocols that you use when you have a pandemic. You start to go out like in concentric circles. You focus first on your known cases, your highly suspect cases, then you broaden your base. And that is what we are doing according to international best practice. Of the six, how many are in that ward now? Again, I don't have that detailed here, but I could get that and get back that for you hopefully tomorrow. Thank you.
Thank you very much. Just before I get to your question about the private security, I don't want to take us off topic. I forgot to mention one thing. In my continued conversations, my continued communication with the attorney at law on behalf of these 33 nationals in Barbados, they informed me yesterday in our continued communication that their clients had been medically examined. I immediately requested that they provide us with the evidence of this and the medical certificates for onward transmission to the chief medical officer. I told him, kindly provide me with the medical certificates. This was yesterday, to which you referred in your letter to me of today's date. So when he wrote me yesterday saying they had received the medical certificates, I asked him, kindly provide me with the medical certificates to which you referred in your letter to me of today's date, so that same may be passed on to our medical experts at the Ministry of Health. Also, would you kindly provide me with copies of the biodata pages of your clients' passports for same to be verified with immigration in Trinidad and Tobago? This morning, I received the various certificates for the 33. So this morning at 9:40, I received the medical certificates with respect to the 33 nationals of Trinidad and Tobago. And if you just permit me the opportunity, these certificates say Barbados Ministry of Health and Wellness, the Health Services Regulation 1969. This is to certify, and they call the person's name, of Sugarcane Club St. Peter, Barbados, was placed in home quarantine from March 24th, which is the day after they arrived, to April 7th, 2020. He, in this case, is fit to be released from quarantine, and those certificates are dated the 7th of April, provided to me this morning. So I've now received these certificates, which will be passed on to the Chief Medical Officer. I've also received the biodata of the passports of these individuals this morning, and that will now be passed to immigration for their verification. So exactly in keeping with our protocols and our procedures which were developed along with the Ministry of Health and the Chief Medical Officer, that is the process that has been taking place. Now, with respect to the question of the private security, which is now history and water under the bridge, as we say, contracts were entered into. Understand it was an arrangement with previous providers who had provided services in 2014. There is not going to be any penalty incurred by the people of Trinidad and Tobago for cancellation of the contracts. The 4 security firms will be paid for the 2 days that they provided service under further discussion, but there is not going to be any penalty, and no sums of money were paid as yet.
Thank you very much, Minister. News source.
Hi, good morning. This is Rhoda Barrett.
Morning, Rhoda. Afternoon.
Yes, sorry. Good afternoon, and of course, happy Easter to any members of the panel that might be celebrating Easter. I've got questions for the Minister of Health and for the Minister of National Security. For the Minister of National Security, are there any updates on the UWI students that the state is supposed to be coordinating their return on? And how will the sampling process that the Minister of Health described at the start be effected? Is it going to be voluntary sampling, or is it going to be selection sampling? And the second question, several countries have stated in news stories that they have been unable to receive supplies, PPE supplies and ventilation machines, as a result of the United States blocking and pulling back shipments. And I was wondering if Trinidad and Tobago had similar issues.
Okay. You want to go? You go. Okay, so I will take the health questions first. Yeah. So the sampling, we are going to start surveillance sampling in the health sectors. Of course, it's voluntary, but it's not a random sample. In other words, you just don't walk up there and we sample you. As indicated, people who currently have any respiratory illness or showing signs of the flu, they will be selected for sampling. And then we will determine, as I said, what is circulating in the environment. Is it H1N1? Is it influenza B? Is it COVID? Is it anything else? This is all part of the sampling protocol, testing protocol as the pandemic evolves. You asked about PPE and ventilators. PPE is coming into this country from other sources on a continuous basis. There is absolutely no shortage of PPE. However, if persons do not heed the call to stay home and start up their own pyramid of infections, that chart I've been shown over the first 2 days, if people continue not to heed the warnings to stay home, and you see that person at the top infects a whole set of people, because it takes over 1,200 pieces of PPE to treat one COVID positive person. Right now, we do not have a problem. However, as you are seeing in other countries, where there's exponential growth in cases, we may reach there. We are not there yet. We don't see us getting there, but the public has a serious role to play to make sure we don't get there. Because yesterday I gave the breakdown. It takes 1,167 pieces 1,187 pieces of PPE to treat one person with COVID at a cost of $5,137 to treat one COVID person. So we have no shortage of PPE, yet I am just alerting the country that this is now in your hands. On the issue of ventilators, let me give you the breakdown on ventilators. In the country, at any one particular time, in the public sector, there are about 160 to 170 ventilators, give or take. Some may be out of service, for repairs, for maintenance, whatever, but about 160, 170. In setting up the parallel healthcare system, we were not going to touch any of those ventilators because you want your current healthcare system to continue running so people can get the service that they are accustomed getting, so COVID does not impact on the healthcare system. We have currently 69 ventilators dedicated only to COVID. In Tobago, we are sending across this week. We expect 10 more ventilators this week. The Secretary of Health reached out to me, said they needed 4 more ventilators just as backup. They currently have enough, but the whole country under the national plan needs to have backup capacity. Of those 10 ventilators which are coming into the country this week, God willing, assuming the flights come in, because you know there are supply chain challenges, 6 will be for Trinidad and 4 will be for Tobago. So currently, there is no talk of any shortage of ventilators. And let me explain to you how we calculate the ventilator need briefly. Of 100 people who come down with COVID, the global figures are 5% of those people may need ventilation support. So with 69 ventilators, we can treat a positive COVID population in Trinidad and Tobago of about 1,500 positive cases. To date, we have 109. So that gives you an idea of where we are with ventilators and PPE. Thank you.
Thank you very much. Guardian Media. Oh, you wanted to say
sorry,
something?
Okay. Minister Dialsing drowned out. I think there was another part of the question that Ms. Barrett asked.
You want her
with
to
respect to UE students. Initially, at the outset, understand this thing is very fluid. So at the outset, there was some conversation about it. Right now, our students are best positioned exactly where they are. They seem to have hunkered down and bunkered down and are doing quite well where they are. The government of Jamaica had indicated a couple of weeks ago for everyone to stay in place because that was the safest thing. As I keep repeating, one of the worst places you can be on right now is on an airplane, being exposed to people all over. So right now, hopefully our students seem to be doing well. This thing continues to evolve. We have our consulates and embassies in Barbados, in Jamaica and other areas that they can reach out to. I've been speaking to the Minister of Foreign Affairs about it over time as well. And just to very quickly, Minister Cox, go back to the previous question about the private security. The Permanent Secretary has told me letters of engagement were issued and all of the 4 firms agreed there is no liability to the state. They will take their payments for 2 days. One of the firms said they don't require any payment at all because of the way this unfolded and they saw it as doing service in the first place. Thank you.
Thank you very much. Guardian Media Limited.
Hey, good afternoon, everyone, and a happy Easter.
Good afternoon. It's Good Friday.
Well, yeah. Okay, so Minister Dialsing, I just want to circle back to one of the questions my colleague Chester Sombrano asked. Is just because I believe that from your response, there may have been a little bit of misunderstanding, and I understand that you need to get back to us with the figures. But what he asked was for the figures of the amount of suspected cases that we have quarantined or isolated in the facilities around the country, right?
Okay.
Just clarifying that, right? The other question that I have for you, Minister, is for the longest while, we've been hearing you saying that now, and especially at the beginning of the stay-at-home measures, now was the time that is going to determine our faith as a country as we move forward and battling COVID-19. But now 2 weeks has passed, we've noticed that the figures are, it doesn't seem to be increasing as much as earlier. So could you tell us, where are we in this journey?
Okay, two good questions. So the number of suspected cases throughout the system, I would not have that detail here. The chief medical officer will have that. So you're asking, where are we? At the very start, we said this is going to be a marathon. And we don't know at which mile marker we are. Let us bear that in mind. What we are trying to do is to put measures in place so we don't crash the healthcare system. Yes, our caseload seems to be reasonably constant, but that is only because we acted swiftly and robustly from January 30th. If the government and the Prime Minister did not take those serious measures from January 30th to now, heaven knows where we would have been. Where are we going with this? We simply don't know. But what we know is that if we don't continue with these measures, we could crash the system. This is a marathon. Let us continue to work together with the social distancing, the hand sanitization, and all the other measures we are asking people to do to save lives.
Okay, so the figures that we are seeing right now, it's too early for us to make any determination using that.
Correct.
Okay, thank you. Could I go back to the Minister of National Security? This is a question online from a Venezuelan national pending residency. And the person would like to know if there would be an extension, if their time expire.
So the position that is being taken by immigration right now is exactly that. Persons whose permits or their persons who have applications in for residency, you're granted a certain amount of time, then you must come back and do the interviews. We said a couple of weeks ago that all of those interviews have been rescheduled, so there is no risk of persons who expire during this period of anything untoward happening to them. So immigration, we've taken the decision that all of these extensions will be dealt with after the stay-at-home period. Persons don't have any risk. They're not taking the appointments right now. And that allows me, Minister Cox, an opportune moment. I had announced, I believe, a week ago that we had closed the immigration offices to upgrade our system and to allow biometrics to take place, and we'll be introducing a new passport renewal system alphabetically. I was informed yesterday that the hardware has been changed out, the software has been changed, in the process of testing. So I've granted permission, seeing that we're in the Easter weekend, for that process to continue. So they'll be closed next week, Tuesday and Wednesday as well, just to iron out the kinks in the system, seeing that Monday was a public holiday nevertheless. Thank you.
Thank you. 98.1.
Good afternoon.
Good afternoon.
Good afternoon.
Question to the Minister of National Security. There are reports that some citizens at this time, or at the time of the...
I'm not hearing you, sorry.
We're not hearing you.
Are you hearing me now?
Yes. Yes.
Right. There are, Minister Young, there are reports that some citizens at the time of their visit to some supermarkets are being turned away from shopping because of not wearing their mask. Is there a legal requirement for citizens to wear masks at this time? And second question, Mr. Dayal Singh.
Yes.
Question further from one of my colleagues. Have we peaked, or are we near to peaking with respect to this COVID-19? Because we've had the last maybe 24, 48 hours without any new deaths, and also we are looking towards the release of persons who have been quarantined.
Okay.
Okay, to answer the first question, I don't know the specific instance that you're speaking about and who it is that turned them away, if it was the supermarket owners or who it was. The answer is a simple no. We have not made it mandatory for people to wear masks out there. Based on the medical advice that we've been given, we are strongly advising and recommending that persons wear masks when you go out and you're interacting with the public. It is up to any particular supermarket or any premises to to tell someone that they would prefer that they don't enter their premises. You have that same power in law as you grant a license to people to enter your house. But certainly I don't think the police are turning anyone away. I don't know the particular instance, but to answer your question, there is no regulation that persons wear masks right now.
Right, thank you. Mr. Cummins, to answer your questions, whether we have peaked or whether we are peaking, that will only be answered when we have a statistically significant number of cases to deal with. When we take out the cruise ship group of 49, we have 60 cases to deal with. That does not give us any statistical significant number to make projections on. So we can't say. It just takes 3 or 4 people to start up their own pyramid and flood the system. It is too early to talk about whether we have peaked or whether we have not. What I can say is that if we don't continue with the measures, all the gains that we have made could evaporate in the blink of an eye. This is not a time for us to rejoice. This is not a time to think that the worst is behind us. As the Chief Medical Officer continues to say, pretend that everybody that you know, pretend that everybody has COVID. And if we do that and keep our foot on the accelerator, history will then tell us when we peaked and when we can get over this. But right now, the message is, keep your foot on the accelerator. Let Trinidad and Tobago show the rest of the world that we can do this.
Thank you. 91.9.
Yes. Hello. Good afternoon to the panel, ministers.
Good
Afternoon.
Colleagues. Vern Extavo here from 91.9 FM. Just quickly, I know that 65 people have been, I don't want to say released, but as well coming to be released from quarantine here in Tobago. In particular, chatting with a couple of them and chatting with a couple others who would have been in facilities in Trinidad as well. They have been noting that they did not get enough counseling information being passed to them. Minister, I know you mentioned counseling is going on. I was wondering, have you been following up on that counseling? Has it been ongoing? Has there been gaps? Because people are claiming that there are gaps in the counseling and they don't feel comfortable.
Okay.
And across to the Minister of National Security, with respect to the persons who have passed their quarantine period and I would say fit to return to Trinidad and Tobago, I know that the borders are currently closed. Tell us a little bit more about that. I'm not sure if I missed it, but tell us a little bit more about that. If they are going to be allowed to come home, if the government is going to provide some access for them to come home, and on the heels of that, what will be the indicator for us to really indicate that we could reopen the borders of Trinidad and Tobago? At what point, at what infection levels are we going to reopen the borders? Thank you.
Okay, so let me take the first part of the question directed to me on the issue of counseling. Dr. Hazel Othello was here, I believe, 2 days ago, speaking about the issue of counseling. What I can say, if any member of the media has information that any patient throughout the system may not be getting optimal care, reach out to us. Don't hold it. Reach out to us, and we will ensure that any patient that you know of is not receiving optimal care, and we will intervene. I will not sit here and say everything is perfect. This is a new situation we are dealing with. So the media and health, we could work collaboratively in the interest of the patient. And if there's anybody, Mr. Exavo, that you know of that needs extra attention, reach out to us at the ministry, at the TRHA, and we'll be more than pleased to provide that extra layer of support to anyone. Thank you very much.
Thanks. Thank you. I suspect you may have joined us a bit late because I went, the whole first part of your question, I went over in very great detail, setting out what the policies and procedures are and how they're being applied. So with respect to the particular persons in Barbados, I've already set that out. I've said what the exchanges were, what the government's policies and procedures protocol were after being directed by the medical experts. So now that they've been examined and we've been today provided with the medical examination certificates, if I can call it that, by the Barbadian authorities, that's going to be passed to the CMO. They are to make their way back to Trinidad and Tobago the same way the persons in Guadeloupe did, and this type of thing. When they arrive here, the CMO and his staff will be the ones to make the next decision with respect to whether they will be quarantined by the state or whether they will be quarantined, allowed to be self-quarantined under the Quarantine Act after signing a quarantine form. With respect to when the borders will be open, that will be completely guided by our medical experts, the chief medical officer, Minister of Health, and his staff, as you're seeing all around the world. And I'd use this as a point of caution. In my earlier discourse, I spoke about Singapore, Japan, and there are other countries as well that open their borders prematurely and too early. And what they're doing now is they're facing a second surge. That is something we would want to avoid. But at this stage, it is premature to have the conversation as to what will happen to our borders beyond the 30th of April. Let's just get closer to the 30th of April, and our experts will advise us.
Thank you, Minister. Sunil, I think it's CLC.
Hello, good afternoon. Sunil Lala from Caribbean Lifestyle Communications. Minister Dialsingh, I know you said you're going to expand testing for the virus for persons with viral symptoms. Now, are you worried that based on CARPHA's criteria for testing primary, secondary, tertiary contacts and travel history, maybe you can guide me on if there are any more, but are you worried that some of these may be rejected by CARPHA? And then finally, I know over 1,000 samples have been tested by CARPHA. How many samples have actually been rejected from them?
Okay, so the expanded testing is being done in conjunction with CARPHA. So these surveillance tests will not be rejected. This is to find out what is in circulation. It's part of surveillance. How many rejected? I would not have that detail on me. I really don't have that level of detail off the top of my head. But the surveillance testing is in keeping with protocols.
Minister Young, was there a question?
I don't think there was anything directed at me.
Okay.
Thanks.
TTT?
Good afternoon.
Afternoon.
Good afternoon.
We've received some concerns from persons who have claimed that they've been denied access to government's salary relief grants. The reasons have been so far that they either do not have valid national ID cards or have applied for them and have not yet received them. And they're asking whether or not they can use other forms of valid identification, such as driver's permits or passports. Can you shed any light on that, Minister of National Security?
All right. Well, as you all would immediately recognize, the salary relief is being handled by the Ministry of Finance, so those questions will be best directed to them. But I'm certain that the Ministry of Finance would have heard what was just posed. I will undertake to raise it with the Minister of Finance. There is certainly no intention on behalf of the government to prevent legitimate persons from receiving this salary relief that we've worked hard to get in place in the shortest possible time frame, on the mere fact that they may not have a valid Trinidad and Tobago ID card. So I feel pretty certain that passports or other valid forms of ID will be utilized, but that will be handled by the Ministry of Finance, and I undertake to bring it to their attention.
Thank you. TV6.
Afternoon, Elizabeth. Hi, good afternoon.
Good afternoon.
Elizabeth Williams, TV6 News. I have several questions. The first one is to the Minister of National Security. If you would have received a legal letter from Martin George with respect to Mr. Philip Almando's threatening legal action if the police closes down his business in Scarborough. And also, additional questions include if we can be updated on the health of the 5-year-old who tested positive for COVID-19. With respect also to the government, I know that $50 million was allocated to the people of Tobago with respect to the COVID-19 fight. I wanted to know if additional monies will be allocated to the THE and if the government is also looking at additional monies to fight COVID-19. And the final question is with respect to supermarkets. Some citizens are saying that a number of people are visiting supermarkets with children, and these children do not have on their masks. Are you advising citizens to wear their masks? In terms of children, sorry.
All right, I will take the questions first. Let me deal with the last one you asked there. we have suggested to persons, if you're going to the supermarket, if you can, just try to go as one person from a family. You're just exposing yourself to a lot less risk. I was also having sent to me a short while ago, certain supermarkets have taken a decision that if you're not wearing a mask, they're not going to allow you in. As I said, in law, that is their right to do. The wearing of the mask is to protect not only yourself, but to protect other people whom you may come into contact with. So we're asking people, please do the best you can, wear masks. I really wouldn't have the children out there without their masks, but that's a decision for you. As I said, it's not mandatory. With respect to the first question, this is something that concerned me very early this morning. I received from the media this letter from Martin George, and I was quite shocked because once again I'm receiving a letter addressed to me from someone other than myself or the sender of the letter. When I read this letter from Mr. Martin George, I haven't been able to speak to him. I called for him. He didn't take the call. He then called back for me, and we've just missed each other. The answer is there was obviously some level of mischief. I consulted immediately with the Commissioner of Police, as we've been doing throughout the course of every single day. The police were not about to shut down Mr. Almandos's place in Tobago. He is one of the major, if not one of the main wholesalers to the smaller groceries and supermarkets. So I don't know why I was sent a legal letter threatening that if we shut down Mr. Almandos's place, what would happen. There was no need for that. You could have reached out in a civil manner. But in any event, it has been resolved. The Commissioner of Police and myself spoke. The police are very clear in their mind that that is a wholesale operation that can continue. I personally got a message to Mr. Almandos when I couldn't reach his attorney to assure him that that was mischief and there was nothing afoot and no attempt to shut him down.
Thank you. So, Elizabeth, let me answer your two questions. The health status of any individual is their private business. As the CMO said in an earlier interview, the only person who will get information on a minor will be the parents. There is something called patient confidentiality, and we must treat that right, strictly. Dr. Hazel Othello also spoke about the issue of stigma when you identify people. So I, as Minister of Health, will not be giving out the health status of any individual patient. What we do at the start of these briefings is tell you the general picture. How many can walk about? 70. But we don't give identifiers that could identify a person. And I think the same privacy rights that any member of the media would like, not having their health status discussed in public, is something that we hold dear. The issue of additional monies to THA, any additional monies that the TRHA will need, a request will be made by the THA to the Ministry of Finance. And I think no reasonable request will be turned down at this time of a global pandemic. Thank you very much.
Thank you very much. We go to Lasana Liebert.
Yes, good day. Lasana Liebert, Ward 868. At the moment, presenting with symptoms means forced quarantine for 2 weeks or more, and all that entails. Assuming that this might make persons less likely to present early, has the government considered allowing persons to self-isolate while awaiting results, at least, so as to encourage more people to come forward early? And can the minister give details on your thinking regarding this, especially as hospital beds could potentially become scarce?
Sure. So the issue that you raised first will be an issue that to be developed by the Chief Medical Officer. That is a medical decision based on his judgment, and I will certainly ask him and get back to you on that. Thank you.
Okay.
You have a follow-up question?
Yes. Sorry, I do.
Go ahead.
Minister Dialsing said we were not testing locally outside of CAFA because although we have kits, there were no extractors.
Yes, correct.
Minister Young said that 33 kits were sent to Barbados to test national. So could you explain if those kits were sent with extractors?
Okay, so let me clarify. The kits that we got from China did not come with the extraction kits. All the other kits that we are using have extraction kits, and the kits that were sent to CAFA have extraction kits. Sometimes they come two in one, the actual kit and extraction kit, but the ones we got from China just came as test kits without the extraction kits.
We have kits to test outside of CAFA.
Sorry?
So we do have kits
Yes,
to start
yes.
testing outside
So
of
that's
CAFA.
how the existing
No,
testing
outside of CAFA.
outside of
We're
CAFA,
only using CAFA.
we are only using CAFA at this point in time.
I know you said you'd go beyond CAFA at
Yes.
some point once we got the
Yes,
machines
and
validated.
once
then
the
when that will
machine
happen.
at NCRHA is validated by CAFA and we get the extraction kits to use those 4,000 tests that we got from China, we are doing that. But we have some challenges getting the extraction kits because international travel, flights have been impacted. But we are making a lot of efforts to get the extraction kits in. So there are two types of kits. Kits that come alone and kits that come with extraction kits. So CAFA has kits with extraction material.
Okay, we move to ACP News.
Hi, good morning, Priya Bihari, ACP News. Happy Easter to all.
Good afternoon,
Afternoon.
Priya.
Good Friday.
Happy Good Friday. I have two questions, Minister of National Security, and one for the Minister of Health. First, Minister Young, can you tell us how many people have been, or how many flights you have allowed to come in with people? You know, how many times you have lifted the restrictions to allow flights to come in? And secondly, I have a query from a contractor. He has people, workers who work on a construction site. He wanted to know if they can continue to work, if that might be considered working from home, because they are confined, they are within an area. They are not leaving the site. And the question for the Minister of Health, Minister Dial Singh, we have over 19,000 Venezuelans who are registered to work here, some of whom work in the medical.
How many Venezuelans you have registered to work here?
19,000.
Over 19,000, is that not true? That figure?
We had registered 16,526,
okay.
and some of those are children.
My apologies. Okay, well,
you got me worried there.
Correct. Well, no, I mean, out of all of the Venezuelans who have been registered to work in Trinidad and Tobago, some of them work in the health sector in Venezuela. Some are nurses, some are doctors, some work in other jobs there. In the same vein that you are bringing in Cuban nurses to work in the fight against the COVID threat in Trinidad and Tobago, can you consider, or is the ministry considering asking these Venezuelans with that skill set of in the medical field, in the health sector, to come and help to fight in this threat against COVID in Trinidad and Tobago?
Okay, so let's see if we could answer the question. We have a government-to-government arrangement, a signed arrangement with Cuba, sanctioned by the government of Cuba and the government of Trinidad and Tobago, to bring in healthcare workers into Trinidad, where the specialty does not exist here. We also bring them in based on that they have a specialty that does not exist there, and they must pass an English proficiency language test. Also, they have to be registered with the medical board and also the nursing council. If a Venezuelan satisfies those criteria to work here and they have a work permit, they are registered with the medical board or the nursing council, and is some specialty that is not available here, they may be considered. But we have to be very careful that, one, they are registered to practice. We're not just going to allow them to practice, because that opens up to lawsuits, whether it's a doctor or a nurse who are not registered. To get registration, we have to check their education. Did they go to an accredited university? We do all that with Cuba. So it's not that easy to say, hire Venezuelan professionals who are here. So I hope that answers your question.
Mr. Bihari, yes, you asked me two questions. The first is about flights coming into Trinidad. I don't have the exact number. It has been a handful, but I can tell you, prior to any permission being granted to a flight to come into Trinidad, there is one condition that is not being bent at all. No one is allowed to disembark. So any repatriation flights, I think initially there were 2 from British Airways, 2 from Virgin, a couple Condor flights, and WestJet as well, where foreign governments made requests. Not a single one of those was allowed until they agreed that no one would be allowed to disembark, thereby protecting the population of Trinidad and Tobago, because no one is allowed to import new COVID-19 cases into Trinidad and Tobago. That is a restriction. With respect to the construction site, you are not essential. We have been asking people, please stay at home, even if it is work being conducted at your house, unless it's being conducted by you and your family members who reside there. The answer is no. We're trying to prevent people from moving around Trinidad and Tobago unnecessarily. We will soon be at the 30th of April. If you all follow what the government's health experts are advising us, and we restrict our movements until the 30th of April, and we follow stay at home, we will be a better place come the 30th of April.
Thank you very much. Tobago, Channel 5.
Hi, good morning.
Afternoon.
Hello.
Oh, good afternoon, sorry. My question is in regards to 14 national Cuban students in Cuba. I've been getting some reports where these students who their classes would have stopped after the border would have closed, and they are now in a kind of tricky situation where they are being faced, like whenever they go to the groceries and so on, they're in Cuba, the Cuban nationals are actually preventing them from accessing the essential services and so on. So they said that they have been trying to reach out to the government to perhaps see if there's a way that they can come home, and because they're in a very uncomfortable situation. And seeing as how the government is trying to arrange a flight to bring some Cuban nurses home, that perhaps they can be allowed in through there. I don't know if you would have gotten those reports, and if you did, could you let me know?
All right, so I will deal with that question. We are in contact with the Cuban authorities. We're doing it through the Minister of Foreign and CARICOM Affairs, because that's the proper way for governments to be in contact with each other. So what we can do is reach out to the Cuban government, asking them to look into that and to ensure that our citizens there are safe, and then we can explore what is happening with respect to the Cubans coming here. The Cubans coming here being brought here by the government of Cuba. So we will have a conversation with the government of Cuba.
Okay, before we move forward, Minister of National Security, there's a question or a suggestion if you all can look at TT Post as a point of passport collection.
Okay, thank you very much, Minister Cox. The answer is I've asked immigration to look at all of the possibilities. Why use this opportunity we have now, where broadening and bettering our computer system and the biometric system. We should also be looking at drop-offs for renewals of passports, and then exactly that suggestion by Minister Cox, which is then utilizing TT Post to post completed passports to people. I can tell you the conversation I had with the Chief Immigration Officer yesterday. One of the things we discussed is, I believe there are about 40,000, approximately 40,000 completed passports for collection at the passport office. So that is going to be our priority when we reopen, and I will ask that they look at the possible utilization of the TT Post system going forward.
Thank you. Express.
Hi, good afternoon. Camille Hunt, Express newspaper.
Good afternoon.
Good afternoon.
Minister Dial Singh, with respect to the patients who were released from Cora, the concern from one of those patients was that she was just awaiting test results, but she was being kept in the same area as other persons who might have been positive. So what is the protocol for quarantining persons who are not confirmed and they are just awaiting test results?
Okay, so the practice is you will have a separate ward for suspected cases where those 6 persons were allowed to go home for, and a separate space for confirmed cases. That is the general protocol to which we stick to. Thank you.
Thank you.
I have 2 other questions, if I can.
Sure.
Yes, I know this would have been spoken about before, but as the situation changes, has the criteria for testing changed? For example, if a person presents with a cough and they have no travel history or no known contact with anybody who has been confirmed positive, does that person qualify for testing? And to the Minister of National Security, the test kits that were sent to Barbados for those TNT nationals to be tested before they return, is this a measure that can also be extended to nationals in other countries for, like, in Margarita? And test kits be sent, can be tested to be able to return?
Okay, so let me take the first part of the question. In the expanded testing regime that the Chief Medical Officer has advised me about, we will be testing people in the community, allocating one health center per county to do what is called surveillance testing. That is, people who present to these facilities with the typical symptoms of viral illness, fever, cough, and so on. The Chief Medical Officer has not indicated that he'll be testing people with cough alone. So we'll be doing surveillance testing, but you must present with viral illnesses. Thank you.
Minister Cox, just to go back to what you raised with the TT post, I'm happy to say I've just been messaged by the Permanent Secretary. The conversation has already begun with TT post, so let's hope that is implemented in a short time frame. With respect to that question, or the question as to sending test kits to other places, the answer is simply no, not at this stage. A lot has changed in the whole global environment since the 23rd of March. That was something done at that time. It's not going to be done now. What we're looking at, and what the Chief Medical Officer has advised us, is with respect to other persons in other jurisdictions, they will need to satisfy that they've been medically examined. So the Chief Medical Officer can then take a decision as to what sort of medical state that they're in. Because certainly if somebody is already COVID positive, God forbid, they shouldn't be traveling. And then what we're going to be asking persons who are in those categories, meaning those away, have yourself medically examined, provide the medical report. So for example, in Suriname, that's what we're working out with the government of Suriname at this stage. But again, I use the opportunity to repeat, the last thing anybody should want to be doing is getting on an international plane at this stage. It's just not a good idea.
Okay. Richard Khan, you have another question?
Yes, I do, and thank you very much for giving me a second round of questioning. What I wanted to find out, Minister of Health, is when these private labs in the country come on stream for testing, would persons who are quarantined for suspected cases of COVID in government facilities, would they be allowed to say, you know what, I'll just go through the private labs?
So people in the public sector, as far as I'm aware through the Chief Medical Officer, will continue to have their tests done free of charge at CARFA. That's the advice I have been given. Once you are in the public healthcare system, you don't have to pay for your tests through CARFA.
But what if somebody who is already in the public healthcare system and decides that they want to pay to get it done at a private lab when it comes on stream?
That is something the Chief Medical Officer will have to look at, but that will upset the protocols that we have. And there was a very good opinion by an independent senator talking about the inaccuracy of private labs. And the Chief Medical Officer has spoken chapter and verse about how many inaccurate results we are getting from the current regime employed by the private labs. Listen, we are in the midst of a global pandemic. We must have faith in the results that we present. Until the private labs have been certified or validated, including the NCRHA lab, which I want to bring on stream, even that lab has to be validated by CARFA, that their processes, that their tests can stand scrutiny. Thank you.
Thank you very much, ladies and gentlemen. We are out of time, but before we go, let us go to the Minister of Health to say a few words.
Thank you very much, Minister Cox. Ladies and gentlemen, as we continue with this weekend, let us remember that the only thing that will save us is to heed the words of the Honorable Prime Minister. If we all stay home this weekend, if we all practice our isolation. I know it's hard. I am fed up. I am fed up at home. But at least I come to work every day still. I know it's hard. I know it's hard. But take this as an opportunity to save Trinidad and Tobago and be citizens that when this is over, sometime in the future, we can't say when, but we have these measures until April 30th. The Prime Minister has led us well. The medical officials have led us well. The science has led us well up to this point. If we follow the guidelines, I promise you again, we will come out of this a stronger and better people. Just stay home, be safe.
Thank you very much, Minister. We have come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. I am Donna Cox, Minister of Communications. Thank you very much for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. See you tomorrow morning at 10 a.m. May God bless Trinidad and Tobago.
Thank you very much, Minister Cox. And